The National Senior Citizen Center of Nigeria, in collaboration with the United Nations Department of Economic and Social Affairs, recently in Abuja, Nigeria, organized a two-day national workshop on development of older persons' care and quality assurance policy guidelines and regulatory framework. The mandate of the National Senior Citizen Center is to put in place health and social care programs, amongst other things, improve the quality of life and the general well-being of the older persons in Nigeria. And this it has been doing in collaboration with Federal Ministry of Health and the National Board for Technical Education of Nigeria. This is aimed at putting an end to organization isolation of health and social care to older persons and establishing explicit nation processes and standards. According to the Director General of the Center, Dr. Omakaro, the purpose of the two-day workshop is the integration of care quality standards in practice, processes, and measurements in line with international best practice into an overarching national policy guidelines and regulatory framework on generic social care.
So you can imagine in a care facility that is very important. Yeah, we don't want people. Sometimes I'm a community geriatrician specifically, and I do go and provide clinical care in people's homes and also in care homes. And it sometimes saddens me when I go to some care homes and I just see residents not engaging in any physical or mental activity to stimulate them, to keep them active. That can be very sad. So we don't want that. We need to think about it. And while we have a title there, anyone with a passion and interest in organizing social and recreational activities can do this. We just had a professor of geriatric medicine got us to do a little Zumba this afternoon. So you can come from any background. And these activities can include arts and crafts, games, exercise programs, outings, and anything really that gets people active, gets the brain active. All of this enhance their overall well-being and engagement, and it's better than any tablets or medicines that I or any doctor can prescribe.
Participation in lifelong learning, paid or unpaid work. So what you're saying here is active learning is that when they come to the center, you can even get them to work at the center or even anywhere else. These people, some of them bankers, doctors, that they could do something. Their bodies may be visceral, but the head is still there. They're still able to do something, even if it's just advising. And some of them, even small things like going into the kitchen and washing up plates. You might think it's belittling, but you are enhancing the activity of using their physical hands to do something.
The expected outcome, according to Dr. Omakaro, is a consolidation of frameworks and standard operational procedures to improve quality of care and well-being of persons and their caregivers, while opening up enormous job creation opportunities and the care industry subsector in Nigeria.
What we are doing is that knowing now the demand in the market. Of course, you know now that so many people are out migrating and leaving their old parents at home. You also know that Nigeria has variations in cultural practices. And Nigeria also have, shortfall in skills, people that are really trained. So NSCC saw that gap. And so what you're seeing here is accumulation of many events, activities, and products that we now want to put together and have an overarching policy guideline on care quality assurance for older persons. We call it geriatric social care. So we are depending on NSCC to advocate, We are also depending on stakeholders consultative forum that we have in every state to advocate. We are also depending on older persons themselves and adult children of older persons themselves to say, no, you cannot stay there. And this thing is, finally we have sanitized this, and this can reduce abuse and harm. And then you can actually have somebody that is trained and supervised, you know, a system that is regulated, and you say, no, I don't want. Why don't you want it? You understand? So everything takes communication, partnership, understanding, and we'll get there.
The technical session paved room for speakers to speak extensively on what is expected in order to meet world standards.
Nigeria is in pole position to be doing this, and why do I say that? We already have several care homes that have been established, and during the session, a lot of participants have mentioned that they are already having some agencies who regulate them. And what we're doing during this workshop is just to talk about the other things that we should be looking at if you're setting up a care home. So we want Nigeria not just to be good, but to be the best in the world. And we are bringing best practices from around the world and sharing in this workshop so that the stakeholders and participants who are here can engage with that, and hopefully, while we may not take everything on board, we can start that journey. Nigeria is an independent government and can decide how it wants to do this. The key thing is that whoever does the regulation hopefully will take on board the deliberations from this two-day workshop.
It covers everything that has to do with health and social care for the elderly, people over the age of 60. And the topics there are about 5 presentations we have to make. One of them is the one we talked about, which said something about the geriatric care, the skills needed by the care workers or by anybody that works in health and social care to be able to work with the aged. And it covers everything, including the recruitment. It covers everything that has to do with the managers, the company, the staff, the care workers, admin staff and all. And what we're saying in effect is, unlike before, when care was just something that you jump in and jump out, health and social care has now turned care into a career. So you have to be properly recruited, well-trained, qualified before you can go into care. And there is another important aspect of working in care, and that has to do with your attitude. So it's not just the training and the experience. You have to have compassion. You have to have the communication. You have to have the love for care and for older people and to work with them. Part of what we need for care is numeracy and literacy. It's so rare to find a Nigerian that's not educated, that's not good with numeracy and literacy. So that's the first one. And caring. In Nigeria, they know us to care for our older people. It goes without saying, the family members care for the older people. So you take that on board and go abroad where most of the time they really don't have that patience or time. So the Nigerians make the best carers, I would say.
Some of the participants, while giving kudos to the organizers, believe the workshop wouldn't have come at a better time. Highlights of the workshop was the interactive session, and members had so much to take home. Participants were drawn from 36 states of the country.
One of the take home here is that how do we set up care facilities for our people? How do we get people who are trained? Because it's not everybody that can cater for old people. We have nurses that cater for younger children. We have nurses that cater for adults. But the work is not even only for nurses. There are people we call caregivers. So we need to have, what qualities do they have? How should they be trained? How should they be placed? What are the regulations that need to guide, against abuse, against malpractices? So a lot of take home here for not only individuals as professionals, for families, for old people themselves, for the state government, for the federal government. There are just a lot of people that are into the work of caring for old people, and this is a unit a section in Nigeria that a lot still need to be domesticated, going by the way things are done at the international level. The federal government needs to operationalize the national policy on aging. There is a national policy on aging. It needs to be operationalized. This will guide policy of what we implement as per the care of older persons. For instance, it will guide the policy on regular payment of pensions. It will guide the policy on, these are the advices that I'm going to give out. It will guide the issue of healthcare insurance, general insurance, social insurance for our old people. It will guide the government on how to combat the increasing spate of abuse of elder people. A lot of people say one old man or old woman is a witch. A lot of things are going on. So the government need to get into action. The care of older people is like a big industry on its own that the federal government has not gotten into. Because by the time the federal government gets into it, you have to create employment for so many people that will cater for old people, that will, even help revenue generation for the country. So the federal government has to do a lot, from the implementation of the policy to operationalizing it to getting the benefit for the old people. Now, federal government need to empower our hospitals, because in these days now, we have the same clinic that want to cater for a 30-year-old man or woman that is just having small complaint. You want that same clinic to also cater for even an old man of 70, 80. The strengths they should not be mixed together. We should have a lot of geriatric center, geriatricians that are trained within or outside the country, and a lot of facilities that will be able to cater for the old people.
Highlights of the workshop was the interactive session where participants drawn from the 36 states of Nigeria brainstormed and made contributions. Indeed, this might be the beginning of a new dawn for the aged in Nigeria.